Hi, welcome to Between Peaks and Valleys. My name is Hannah, and today we're going to be talking about Placenta Previa. It's an educational video, and I get my information from .edus and .orgs. I also use my own experiences, so if I don't cover things, that's because I haven't experienced it. And now, before we dive into that, I'm just going to give out my little warning. I am not a doctor. I am not affiliated with a hospital or the medical field whatsoever. I have no education in it. I just have my own experience. Always bring your questions and concerns to a medical professional. Please don't use vlogs, blogs, Facebook, social media, YouTube, whatever, to be asking about your own medical questions. It's just, you know, you're not going to get the answers you need. And if you're going to do research, please use .edus and .orgs for the best information, and then present that with your question to your medical team so you get the best answer all around for your health. Like, not everyone's going to be the same. What happens to me does not mean it's going to happen to you. And that's a big fact that you should know. So, I wanted to do this video because when I looked at the risk factors of what causes placenta previa, I was like, holy moly, like, so many people go through this. And you know what? I've been doing this video, I've done it like probably 14 times. And I'm going to do it backwards now because I feel like I haven't had a good, like, sway into things, like discussing what it is to the risk factors. So we're going to go backwards. We're going to say what the risk factors are and then exactly what placenta previa is. And maybe that will be better. So, risk factors that occur can include, but not limited to, I got my handy dandy notebook, so that's close to my microphone. I bet you that was loud. Uterine scarring, typically from previous C-sections. That's like the number one reason I was like, I need to do a video specifically on placenta previa, because I just know a lot of people that had C-sections, and I don't know if they were ever told that you're at risk for getting placenta previa if you deliver C-section and then go to get pregnant again. It's like scary. It's scary. Someone that's dealt with it and the emotional side of it, it's not something to take lightly. It's not to say like this is what I had in December, because it's not. I got cleared of it in November, but I do think it led up to the issues that happened in December. And that's why I'm like, I need to make a video. I need to just share this with people. I need y'all to know. So that's that, as well as a D&C. Now, I didn't know this, but a D&C sometimes can happen after a miscarriage. And I don't know if people are aware that that could also cause, I'm sorry, I can't say cause, could include a risk factor. I think that's wording it politically correct. Also, removal of uterine fibroids. I'm not going to speak on things I haven't dealt with, so I don't really know what that is. But if you have them, be aware. Your risk factor of getting placenta previa, if you plan on trying to have babies after, has now gone up. I don't even know if that's something. I just don't know anything about that. I got nothing. All right, there's also your uterine structure. So having an abnormal uterus, like the shape of it, that could make a higher risk of getting placenta previa. Multiples in pregnancy, so like twins, triplets, that situation. And I think that they say that on here because typically when you carry multiples, you have a C-section. So I think that's why it's ended up on this list as well. They say maternal age, and then they put women 35 and older, but I was 29 when I was first told that I had it with one of my pregnancies. So we can say what they say, but just a heads up. And then this one was the other reason that I was like, oh my gosh, because assisted reproductive technology, in other words, it's art, but most commonly known to us women as IVF. I would have never thought that. And I know a lot of people that do IVF and then have a C-section. So I feel like your chances just went up, like even more. And so that's another reason I'm like, hey, I just want to get this information out there to these people because this is just crazy to me. And then your lifestyle choices. They specifically say cocaine. I was gonna just say drugs and smoking, but they specifically say cocaine, so I guess it's really related to that one. Not sure how they understood all that, but that's, I would think other drugs did the same thing, but I don't know. I don't know much on drugs. And then I know what caused mine, and I know it wasn't smoking. So, and I'll get into that in a different video. I had it in one video with everything together, and I just felt like it needed its own, so I ended up deleting it. And it also was like a 40-minute video, and I felt like that was too long. And it's depressing and sad, and I didn't want that to be what the theme of educational videos is. So, with that being said, we will get into placenta previa, what it looks like, and I have an image that I looked up personally. It is on clevelandclinic.org. I'll probably screenshot it and throw it in the comments along with the link, just so you guys have the information that you can get it firsthand as well. And let's see if I do a better job this time recording versus last time, because when I show my screen to you guys, I'm using like the hands on a clock, the time, to tell you guys like where something should be or shouldn't be. And when I did it the first time, I was like 11 o'clock. But in reality, when I played back the video, it shows it at like a 1 o'clock. And I'm like, I have to make the video all over again because of that minor mistake. So here we go. Here is, trying to get that glare off. There we go. A normal pregnancy has the placenta up here. See, on my end, it looks like 11. But on your end, I think it looks at 1. And then there is the cervix, right? That little like gap where the baby's head is. So that is a normal pregnancy. To me, that looks like that baby is going to be coming out soon. Which is interesting because most placenta previa is shown, I want to say, in the early months, and then it can actually get better on its own in time. And so for them to show a baby this size to me just kind of seems like not accurate, but that's my opinion, and that's also what I've been through. I haven't had it at full term, so I'm only going by my experience. But these people must be the most knowledgeable people, and they must be going off of everyone else's. So here we go with placenta previa. The placenta is down here on top of the cervix. It can also be where it's like partially on top, so half the cervix is covered, or 3/4 of the cervix, or a tiny bit of the cervix. What they want is for the cervix to not have any pressure on it at all, because the issue is if there's pressure on the cervix, which is like your circle here, there we go, there's your circle. If there's pressure on the cervix, then your cervix will start to dilate, and it could open up just like that much. But that means now you've had the risk of infections going into your uterus, which is holding your baby, as well as things coming out like blood or a placenta or worse. And when that pressure continues, your body starts to think like we're getting ready to pop out a baby. It can fully dilate. And that's not what anybody wants. And so doctors typically do watch it closely, and they want to make sure like you're going to be okay, and they'll give you some guidelines and let you know like, hey, don't do anything strenuous. Mine told me not to lift anything more than 10 pounds, rest as much as possible, don't go for long walks. um like you could still get up and walk, but just don't go crazy. And just know, like, 10.5 years ago they said I could bleed out, where this time around they were more like, I think, just concerned with other things. They were like, okay, you have placenta previa, but we're actually concerned that you might have placenta accreta. And they were concerned about that because that can go into your organs. And at that part of my pregnancy, they're like, our responsibility is for you, not, as they would say, the fetus. I would say baby. Um, but no matter what, in my whole pregnancy, I was like, well, my concern is the baby. So it is what it is. But that is the information that I have, and I will put the links in the comment sections below along with that visual so that you can get a better look at it if you need to. And if you feel that this is something you might be dealing with, like, talk to your doctor about it. And if you didn't know that IVF and C-sections could potentially put you at a higher risk for placenta previa, now you know. And that's really the point of these videos, is just to like give knowledge to people. And that's it. So I hope you enjoy it. And if you do, please like and subscribe. I already know you're watching. So might as well just click the button and help a girl out. Okay? Talk to you later.